Hey, this is Dr. Lowenstein, and we, as I think I've said in some other videos, we've recently put out a migraine quiz to help patients try and figure out if they may be candidates for migraine surgery, and we'll put the link to that down here. But I wanted to talk a little bit about that in a video in one of the areas that we treat. And so a lot of people, when they're having migraines, they're complaining that the migraines are kind of in their one or both temples, and they'll find themselves kind of rubbing here, trying to get relief here. And there's a good reason for that. And that, we're going to use our friend here, a model sent to me by a very good migraine surgeon in Europe, Dr. Mulberger, who's in London and Berlin. So if you're in Europe, that's where to look. You can see here that right in the temple region, there are these two nerves, okay? So this is the zygomaticotemporal nerve, and this is the auricular temporal nerve. And this is the superficial temporal artery. And these nerves are right here above the temporalis muscle. They actually come through the temporalis muscle and are right in this area. And when the irritation of these nerves is causing a migraine, what people will do is kind of rub this area to try and release that tissue and kind of free up that nerve just manually. And unfortunately, that can give you some temporary relief, but it's very rarely gives you kind of permanent relief. And so when we do migraine surgery on those areas, we can release those nerves or sometimes even cut them. These nerves, they provide sensation to like really, really small areas here and here. And if they get cut, you really don't even notice it because it's such a small area of an issue, and we bury the nerves into adjacent muscle if we cut them in order to prevent neuroma or excessive scar formation. But in many cases, we just release them from that temporal muscle. And the temporal muscle you can actually feel. If you put your fingers up here in your temple and clench your teeth, you can feel that muscle get tight. And so if you clench your teeth at night or clench your teeth or get tense here with stress, these are the nerves that can cause problems. So if you find yourself rubbing here for migraine pain that's here, that's an indication that migraine surgery may be able to help you. And certainly we need to do some nerve blocks to make sure that you're a candidate. But again, all of this is discussed in the quiz for migraine surgery, and I encourage you to take that. And if you have any questions, please feel free to give us a call. Again, Migraine Surgery Specialty Center, we're here in Southern California and in Denver. Phone number is 805-969-9004, and just happy to answer questions and let you know if potentially we can see you to figure out if you're a candidate for migraine surgery. And migraine surgery produces favorable results in over 90% of patients, and about 38% of patients never have another migraine again after surgery, and the rest, up to 93%, have at least 50% less surgery, 50% less headaches, and 50% less pain in those headaches. So can really be a life-changing experience. So hope that helps. Give us a call if you have any questions. Thanks. Bye-bye.